Trends, Den Trends.
Hello everyone, and welcome back to another episode of the Den Trends DenTalk podcast. I'm delighted to have you with us as we continue exploring the latest innovations shaping the future of dentistry. Today's topic is one of the fastest growing areas in modern dental practice, Smile Design 2.0, where digital technology, artificial intelligence, facial analysis, and cosmetic dentistry come together to create highly personalized smile transformations. For many years, cosmetic dentistry focused mainly on improving the appearance of individual teeth. The goal was often to create whiter, straighter smiles. While those treatments delivered excellent results, today's patients expect something more. They don't just want beautiful teeth. They want a smile that looks natural, complements their facial features, and reflects their personality. That's exactly where Smile Design 2.0 begins. Digital Smile Design, commonly known as DSD, transformed cosmetic dentistry by introducing a structured digital workflow. Instead of planning treatment solely from dental models or intraoral photographs, clinicians began using facial photographs and videos to analyze smile proportions, facial symmetry, lip movement, tooth display, and gingival aesthetics. This represented a major shift in treatment planning because it recognized an important principle. A smile should never be designed in isolation from the face. However, as digital technology continued to evolve, traditional digital smile design also revealed some limitations. Much of the analysis depended on static photographs. Treatment planning often required significant manual work. Dynamic facial expressions such as speaking, laughing, and smiling naturally were sometimes overlooked. Today, artificial intelligence is helping overcome many of these challenges. Modern Smile Design 2.0 combines digital smile design with AI-powered simulations, advanced facial analysis, standardized photography, digital workflows, and interdisciplinary collaboration to create a more accurate and patient-centered treatment experience. So, what makes Smile Design 2.0 different? It begins with comprehensive patient documentation. Instead of relying on a single smile photograph, clinicians capture standardized facial photographs, along with dynamic videos showing natural speech, smiling, and laughter. These videos reveal information that static images simply cannot provide. They help clinicians evaluate lip dynamics, smile width, incisal display, facial symmetry, and the way the smile changes naturally during conversation. The next stage focuses on facial aesthetic mapping. Rather than beginning with the teeth, clinicians first analyze the entire face. Important landmarks such as the interpupillary line, facial midline, lip position, alar width, smile arc, and soft tissue profile are carefully evaluated. These facial references help create restorations that appear balanced and harmonious instead of artificial. Modern cosmetic dentistry is no longer about making every smile look identical. It's about creating smiles that are unique to each individual. One of the most exciting developments in recent years has been the introduction of artificial intelligence into smile design. AI-powered software can analyze facial proportions, segment tooth anatomy, identify asymmetries, and generate realistic smile simulations within minutes. Patients can now preview potential treatment outcomes before any irreversible procedure begins. This has dramatically improved patient communication and treatment acceptance. Instead of trying to imagine the final result, patients can visualize it. However, it's equally important to remember that these simulations are planning tools, not promises. Every patient's biology is unique. Final outcomes depend on many clinical variables, including tooth structure, soft tissue response, healing, and restorative techniques. For that reason, AI simulations should always be presented as educational and illustrative, rather than guaranteed results. Proper informed consent remains an essential part of ethical cosmetic dentistry. Another important feature of Smile Design 2.0 is interdisciplinary collaboration. Today's smile makeover often extends beyond veneers and crowns. Many comprehensive cases involve collaboration between restorative dentists, orthodontists, periodontists, prosthodontists, oral surgeons, and facial aesthetic practitioners. Procedures such as gingival contouring, crown lengthening, orthodontic alignment, implant placement, botulinum toxin therapy, and dermal fillers may all contribute to achieving optimal facial harmony. The goal is not simply to improve the teeth. The goal is to improve the entire smile within the context of the patient's face. We're also seeing significant changes in aesthetic preferences. For years, extremely bright Hollywood smiles dominated cosmetic dentistry. Today, patients increasingly request natural-looking restorations. They appreciate subtle translucency, realistic surface texture, individualized anatomy, and age-appropriate shade selection. Natural beauty has become the new standard. Equally important is the growing emphasis on the pink aesthetic. Healthy gingival architecture has become just as important as tooth shape and color. Symmetrical gingival margins, healthy papillae, and balanced soft tissue contours play a critical role in creating truly exceptional smile designs. Advances in ceramic materials have also transformed minimally invasive dentistry. Modern lithium disilicate and zirconia veneers can often achieve remarkable cosmetic improvements with extremely conservative tooth preparation. In carefully selected cases, little or no natural tooth structure needs to be removed, preserving long-term dental health while delivering outstanding aesthetics. Despite these remarkable technological advances, clinicians must always balance innovation with ethics. Powerful digital simulations can sometimes create unrealistic patient expectations or encourage unnecessary treatment. As dental professionals, our responsibility is not simply to create attractive smiles, but to protect healthy tooth structure whenever possible. The principle of minimal intervention should always guide clinical decision-making. Technology should enhance clinical judgment, not replace it. As artificial intelligence continues to evolve, we can expect even more sophisticated digital workflows. Future systems may integrate facial scanning, intraoral scanning, CBCT imaging, jaw movement analysis, and AI-driven treatment planning into a single comprehensive platform. This will improve communication, increase accuracy, reduce treatment time, and deliver even more personalized patient care. But despite all these innovations, one truth remains unchanged. Exceptional smile design is not created by software alone. It is created by the knowledge, artistic vision, clinical experience, and ethical responsibility of the dental professional. Technology is simply another instrument in the hands of a skilled clinician. As we conclude today's episode, remember this: Smile Design 2.0 is far more than a digital workflow. It represents a new philosophy of patient-centered dentistry, one that combines science, technology, artistry, and human connection to create smiles that are healthy, functional, natural, and uniquely personal. Thank you for joining me for another episode of the DenTrends DenTalk podcast. At DenTrends, we're committed to bringing you the latest clinical innovations, emerging technologies, expert insights, and global dental trends that are shaping the future of our profession. Visit dentrends.com to discover more podcasts, clinical articles, product reviews, technology updates, conference coverage, and educational resources designed for the global dental community. Until next time, stay informed, stay inspired, stay ahead with DenTrends.